back, Alan. We're going to start with a hot topic right away.
Straight into a hot topic that I know is important to you. It's about lip lifts, Joe, and if there's ever been a guy who needs one, it's you.
Well, we'll talk about that, I'll tell you.
Good.
Joining us today is Dr. Benjamin Stong. He's talking about the new Perialar lip lift and how this new procedure is a better way to enhance a woman's lips. Unfortunately, I'm not a woman. Welcome, Dr. Stong.
Hi, thanks for having me.
Oh, it's our pleasure. Explain what a lip lift is. I'm unfamiliar.
A lip lift is a procedure where you take basically a strip of skin out at the base of the nose, and then you release the skin from the muscle down to the border of the red lip, and then you lift the skin and suture it to the base of the nose, and it permanently rolls the lip out and gives more what we call red lip show.
Wow. You know, Dr. Stong, first of all, I want to correct Joe. It's fortunate that he's not a woman, and you can't see him, but I can, and that's how I know that. Dr. Stong, what is the difference between a traditional lip lift and the new Perialar lip lift?
Yeah, so the classic workhorse of lip lifts is called the subnasal lip lift, and it basically extends the level of skin removal from the edge of one nostril to the edge of the other nostril. And effectively, it really lifts, at least proportionately, the central third of the lip way more than the outer two-thirds of the lips near the corners. And to me, even though some of them can look good, it also looks like that classic cartoon of Betty Boop's lips, where the central portion is really prominent and the outer portions are very thin, or even sort of like a rabbit's lip nose area, where it's exaggerated in height in the middle of it, and the outer corners are droopy. And so I had started to wrap around the nostrils up into the top of what we call the nasolabial folds of the cheek, where the cheek meets the lips, and do a much more lateral excision of skin, or outer, outside that third into the two-thirds on the outer corners. And that really gave a more comprehensive, complete lip lift. And I started just seeing the differences between my results and all the other docs doing the more standard subnasal lip lifts. And I just liked the way it looked a lot better. It looked more natural. It looked more broad-based. It was a more complete rejuvenation. We even started seeing, or not started seeing it, we noticed that it started shortening the width of the skin of the upper lip, which looked better too. It was just a much more comprehensive rejuvenation of the entire upper lip, skin, red lip, cheek area aesthetics, and it can even sometimes soften the nasolabial folds and look like somebody's even put filler in there, making their mouth look even more youthful.
Doc, this is so interesting to me. Why are lips so important to a woman's sensuality? I'd like you to explain that to us.
The lips and the eyes are the most sensual features of the face. They're what capture the primary gaze when you first meet somebody, typically. It's also one of the reasons that rhinoplasty is such a common procedure, because when a nose is big for the aesthetics of a face, it detracts from those sensual features. And then, when you break it down, well, does the lip look voluptuous? Does it look desirable? If it's very thin with no red lip show and no little bit of pout, it can just look aged and deflated. And filler's not the solution all the time, and that's one of the problems, is that people who don't know about lip lifts or don't do lip lifts are just going to keep suggesting filler to try and enhance the lips. And I do a lot of these lip lifts, and I commonly am doing it because the person's been to 4 or 5 different injectors, didn't have any result that they liked, and it was because their lip is too long. And when you put filler in, it only makes it potentially longer. And it looks almost simian-like, for lack of a better way to describe it. And it just looks weird. And the lip lift is a much better solution, but even oftentimes they just don't know about it. They weren't told about it, but they're super happy after they get it done.
I think that's important. So explain to us how the lip lift process works.
It can be done under local. Most commonly, it's done under local in the office, in our minor procedure room, for instance. It could be done under general. Oftentimes, it's a very common procedure for facelift clients to add on to their overall procedure that they're having. But it takes about an hour or less to complete. There's a suture line at the base of the nose. There's intense swelling, and to be quite honest, clients say that it's a very hard procedure to recover from. Your lip is inflexible for even up to 2 months, and 2-3 months, and you're not smiling exactly as you did beforehand. It all eventually goes back to normal. But it is an intense procedure to recover from. Stitches come out about 4 or 5 days after the procedure. The main bulk of the swelling is down by 2 weeks. Once you get your stitches out, you're on autopilot, so to speak.
Dr. Stong, thank you so much for joining us. It's a very interesting subject and everything. How can our viewers get more information about this procedure?
Yeah, lip lifts are all over the internet. Our website's Kalos, Kalos -plasticsurgery.com. We have a lot of intense information, or a lot of information on lip lifts. We have a lot of before and after pictures. I encourage people to look at the before and afters and make sure that that's what they're looking for, because there's a lot of variability. And then our office number is 404-963-6665.
Great. Dr. Stong, absolutely a terrific cosmetic surgeon, great resource for women who might be considering this procedure. Thanks for joining us today on Morning Coffee.
Yes, sir. Thanks for having me. Have a great day.
Yeah, you have a nice
You too.
weekend, Doctor.
Great.